Your seats. Thank you all for being here this morning. I want to start by giving we need to make sure that we know exactly who's here. So, Madam Clerk, would you please open the roll, do a roll call? Thank you, Madam Clerk. Okay, thank you very much. Yes, it is. Before we go into the subcommittee reports, I'd just like to announce that if you're here for Senate Bill 635, that's Senator Serville's Bill 635, that bill is going to go by for the day. So that way you don't have to sit and wait until I get to that third portion of the calendar, if you have other things you may need to do. And also for Senator Lewis's bill, 1037, that bill is going to be re-referred to local government. So I want to make sure that we go on and do an electronic vote on that. So if anybody's here wanting to hear that bill, you'll know that it's going to be re-referred to local government. So Madam Clerk, can you open the roll? Close the roll, Madam Clerk.
Yeas 13, nays 0.
Okay, Senator Lewis's bill 1037 will be re-referred to the Committee on Local Government. I'd like to start with the subcommittee reports, and I will start first with the Subcommittee on Public Education. Senator Hashmi.
Good morning. The first bill that was heard in the subcommittee is SB 80, Senator Marsden's bill on student journalist and freedom of speech in the press. And it was passed out of committee with an amended substitute with a vote of 3 yay and 2 nay. And the substitute was focusing on the removal of language regarding the public middle schools, and there was additional language that is focused on making sure that there is a definition of bullying and that it is a part of the school board policy as well. So out of the committee meeting and the discussion, it was passed, as I mentioned, with a vote of three yays and 2 nays. And as Senator Marsden has expressed, there is peace in the valley now. If you wish
That's
to
right.
speak to it.
The substitute that is before you, has that been passed out, Madam Chair?
Yes.
Okay, the substitute before you is the changes that were made after the subcommittee hearing. There was not peace in the valley at the subcommittee hearing, and the 3 changes that were made is we took out middle school children. We added a provision that anything that's published by the students could not be defined as bullying as we define it in the code, and also put in a proscription against any violation of school board policy. So those were the 3 things the Department of Ed asked that the bill be changed, but those took place after the 3-2 vote in committee. That's been done since that time. So if there's someone here from the Department of Ed who could speak to me. There we go. Thank you.
Stacey Haney, I'm not from the Department of Ed, though. School Boards Association. Yes, School Boards Association. So yes, Senator Marsden, the substitute made the changes that we requested, and we appreciate the senator making those changes to address our concerns. Thank you, Madam Chair.
Madam Chair.
Senator Newman?
Dave, why do we need to do this, right? I mean, school boards all over the Commonwealth are making these determinations, and I get there's some good stuff in here, right? But why do we need a state policy to tell local school boards what needs to be and what can't be in their high school publications?
Thank you, Senator Newman. Madam Chair, this bill comes to us largely through the work of the Virginia Civic Education Commission. It is a means of heightening the awareness that we have in our school system about the free press, and to teach young people the responsible way to report on issues that are important to and mean something in their school environments. And we felt like we needed to have certainly some greater freedoms for students to express their opinions, but to put in guidelines for that. And certainly, as you can see, with the addition of the making sure that school board policy would not be violated, we felt that there was a protection there for the school system. They're still the publisher of these documents, but we felt that it was a good measure to put the state on an even playing field policy-wise, so that people can create student publications that are responsible, that teach kids all about journalism and the free press and their obligations, while at the same time not harming any individual who they may be writing about, or any problem that they may be writing about.
Madam Chair.
Senator Newman?
So if something is determined just be in poor taste or, and it doesn't meet one of your requirements, basically, can you write about whatever you want to write about, notwithstanding the school's thought about it, as long as it's not one of the enumerated items or profane or harassment? I mean, basically, are you going to take away that control of the local school board?
Well, the school board policy can't be violated if the school board has a policy about certain kinds of publications, and at the same time, the principal of the school is still the publisher. They certainly have editorial rights in this, but this just provides guidelines for the students as to how they are to pursue their First Amendment rights.
Thank you.
Madam Chair,
Senator Peterson?
and I guess my first question would be, why do we need to put this in the code?
Senator Peterson, Madam Chair, I think it's important that, given the nature of the environment in this country right now about the free press, fake news, all of the things that we see out there, starting to lay out some guidelines and starting to teach the ethics of journalism, and providing some guidelines for our public schools to proceed with supervising student publications, I think is a very, very important thing. It's an important mission that the Commission on Civic Education, who were the predominant force behind this, and we think it's critical to bring this issue up to the front page, if you will, and make sure that people know that there are rules and responsibilities that go with it, and schools will grapple certainly around the edges of what's appropriate and what isn't, but they're doing it now, and problems do arise.
Further question, Madam Chair.
Senator Peterson?
So this is for high schools. We're going to do one for colleges or junior colleges also?
It was not our concern to deal with colleges and universities and to deal with these are adults, and we just want to make sure that young people have some guidelines, and schools have some guidelines as to how to approach these problems, because they do pop up.
Further question.
Senator Peterson?
What if I'm a student, and I certainly would have written this when I was a high school student. I write an editorial saying the principal's an idiot. Is that protected speech?
Well, not if it violates the bullying statute that we put in here, that if they're attempting to bully somebody in that regard, and I think that would qualify as bullying, and I think that would be unallowed.
So I'm
Disallowed.
bullying.
Senator Peterson?
Madam Chair, so I'm bullying an authority figure if I criticize them.
Bullying applies to everybody.
In queue, I have Senator Donovan, Suderline, and Cosgrove in that order.
Thank you, Madam Chairman. Senator Marsden, could you please tell me the problems that we've had? I mean, children have been educated on journalism with school newspapers since we've had schools. So I hesitate to legislate hypothetically. And can you please tell me some specific problems that have resulted in a need for us to codify this and mandate it to the school boards?
I'm not familiar with a number of them. I know one that took place in the local high school that I took place, a number of years ago, involving a football coach who had made some statements and had been taken to task in the student newspaper that were inappropriate. And these things do happen.
Madam
I think
Chairman.
probably.
Thank you, Madam Chairman. And was that situation taken care of with the current guidelines that are in place by that school board?
After a great deal of pain and discussion, all things kind of fade away, which is what it did. But I think the scars were there for quite some time, and someone's career was was damaged to a certain degree by a student publication.
Senator
And
Marston.
so hopefully this,
Senator Donovan?
Thank you, Madam Chairman. I would suggest you are setting us up for scarring and bruising many more people with these guidelines that are going to create conflict when these issues are being well managed at the local level. Thank you, Madam Chairman.
You're welcome. Senator Suderline.
Thank you, Madam Chair. So I was editor-in-chief of the medallion that was in the 37th district, and then on the editorial board of the Valedictus there at Robinson. And I saw earlier the bill dealt with middle school, which would have been the medallion. Why does it no longer deal with middle school?
that was certainly a compromise made that the folks who testified, who had concerns about the bill, were very concerned that the maturity level of 7th and 8th graders, that they wouldn't be able to absorb the kinds of restrictions we were putting on here and the kind of guidance that we were putting on here, and that it was best done through the 9 through 12.
Senator Suderline.
Thank you, Madam Chair. I would just suggest, just like Senator Peterson said, I had some of our editorials at the Valedictus suppressed, and I think that we were all better off that happened because, even though I thought I was more mature when we moved on from the medallion in 7th and 8th grade to the Valedictus in 9th through 12th, we still were minors and we still don't have the best of judgment always. But I just think that I've got the same concerns that Senator Peterson, Senator Donovan, and Senator Newman echoed from my experience at the student paper, which at the time was the largest student paper in the 37th and in the state. So I just got those concerns.
I remember it well, Senator Suderline, and your many thoughtful editorials.
Thank you.
That you wrote.
Senator Cosgrove.
Thank you, Madam Chairman. Senator Marston, aren't we really kind of having the government overreach into the local school jurisdictions? My chief of staff serves on the Chesapeake School Board, and they do a pretty good job, as do most school boards.
Senator Cosgrove, I think this doesn't take anything away. Still, school board policy prevails. It's in the bill. But it provides some guidance for the students so that they can be taught what to do and not to do before running into the policy of the school board and the publishing responsibilities of the school principal.
Madam Chairman.
Senator Cosgrove.
Senator Marston, I understand that you're saying the school board policy prevails, but basically their policy is going to be directed by this bill.
To a certain extent, certainly there are any number of school board policies that would not be addressed by this bill, I would assume, in terms of the review process that students go through before getting something published. But we're just using this as a teaching instrument for kids, to teach about libel, to teach about slander, to teach about bullying and what have you. And what this does is suggest means by which the publisher, of the school newspaper, or who is the principal, will have to teach them what is appropriate and what isn't. And it just kind of puts the state on the same playing field.
Senator Marston, I've violated my own rule. This had gone to the subcommittee, and so it sounds like we're hearing this all over again, but I'm going to allow these speakers that I have in the queue, we're going to cut it off and go by the motion that's going to be given by the subcommittee chair. In queue right now, Senator Hashmi, Chafin, and Sasslaw. And that will be the end.
Madam Chair, I actually want to speak in favor of the bill and just echo some of the thoughts that we had in the subcommittee. As Senator Marsden spoke, this is a very important opportunity in terms of education to provide student journalists a chance to learn about freedom of press, freedom of speech, self-regulation, and making sure that they are abiding by the laws that surround libel and slander and are behaving in an ethical manner. And as a teaching opportunity, I think this is a strong recommendation. It offers guidelines and structure for a program in school systems that sometimes is not as well regulated. So I want to just express my support for this bill.
Senator Chafin?
Thank you, Madam Chair. Senator Marsden, the school board the school boards aren't asking for this, are they?
No, but I believe at this point in time, they are comfortable with that because we amended the bill to deal with their concerns. And at this point in time, they appear to be comfortable with it.
Further question, Madam Chair.
Okay,
Further question.
let's work.
Further question.
Senator Chafin, I'm sorry.
Yes, sir. So you use the words restrictions, directions, when you're describing the contents of your bill. In what way do you think that the First Amendment needs to be restricted or directed by your bill or through policy?
Senator Chafin, Madam Chair, when students are going to be writing something, you as an attorney are familiar with what is slander, what is libel. As an attorney, you would be able to interpret whether something violates the bullying definition that we have here in the Commonwealth, and certainly would be able to interpret school board policy. We think people can do that, and that this just provides some structure around how we educate our kids and what's important that they not go too far, but at the same time giving them their First Amendment rights to speak up without violating these provisions. We do have to exercise, control and nurturing of students, but at the same time, we're easing them into the use of the First Amendment without making a lot of mistakes that could hurt and harm people. And so there's provisions in here to protect people from overzealousness, if you will, and while at the same time giving them and teaching them a framework by which to conduct student journalism. And I think that's a valuable thing, and I agree with Senator Hashmi that this is an important step forward. All over the Commonwealth, schools will begin to have the discussion around this bill as to how they're going to deal with it, and I think that's a good thing.
Senator Chafin, you have any further questions?
I have one more question. Senator Marsden, I suppose the group that brought this to you doesn't think the school boards are doing a good enough job. Would you agree?
Well, the group that brought it to me is the members of the Civic Education Commission. This is part of our mission, is to teach the civic responsibility, which responsible use of the First Amendment is, I think, civic responsibility, and so therefore. They are aware. These are educators. These are people who work for the the press. These are people with a passion for teaching young people responsible government, and so yes, this was important to them, and they bring their experiences over 20, 30, 40 years as teachers and principals and what have you, and feel that this is an appropriate way to move forward.
Madam Chair, if I could just
Senator Chafin?
speak to the bill.
Yes.
Madam Chair, I think that all amendments are important. We hear debates. We're going to hear a lot of debates this entire session about the amendments to the Constitution. The First Amendment certainly doesn't need any help in regard to being restricted or in regard to being directed or in regard to policies. And I believe that is the effort that is being made here. In some way to put belts and suspenders on our First Amendment to the Constitution in a way that the school boards really don't want. I mean, they form their own policies and they do a good job educating our children.
Thank you. Senator Saslaw and then Senator Newman.
Dave, first of all, I've gotten no requests from either students or administration that, we've got a problem. That's number one. Number two, the only time that you ever see anything referring to this in the newspapers, and it's a rarity, but occasionally there's a story that, that students were in conflict with the administration. And since it is a rarity, I assume that probably 99% of the time, things are running fairly smoothly and we don't have a problem. Finally, and I don't know how I can put this any more succinctly, can you imagine giving a free rein to a 16 or 17-year-old Dick Saslaw at Wilson High School in the late 50s.
Madam Chair, Senator Saslaw, this bill was put in place to deal with the young Dick Saslaws of the world, to provide school board policy as the overriding authority here, but at the same time, you're teaching young people before it gets to the publishing wall, if you will, of the principal, that they have exercised appropriate restraint, but at the same time have learned how to proceed forward with responsible journalism. And that's all we're trying to do here. And I think it's a valuable thing, and leave it at that.
Well,
Is Senator
Madam-
more mature, Saslaw?
well, you all can decide that, but I mean, I would have probably come pretty close to starting World War III, which I damn near did when I was in the Army overseas in the late 50s.
Senator Saslaw, this would provide greater education for you prior to you starting World War III, and at the same time leaves in the final authority of the school board.
Senator Newman?
Madam Chairman, I understand the primary motion is the bill be reported as amended. Madam Chair, I would like to make a substitute motion that the bill go by for the year. I think that, one, we've got a lot of important things today, and I don't know if we've got enough time to work our way through this today, but I just think that there's still some concerns about whether or not we're impinging upon local governments. And so I would make the substitute motion, Madam Chair, that the bill go by for the year.
You heard the substitute motion. Is there a second? Oh, there's a substitute motion. A lot of seconds. Madam Clerk, please open the roll.
Thank you, Madam Chair, members of the committee. We'll proceed on and be back next year.
Thank you so much.
Yeas 13, nays 1.
Senator Hashmi?
SB 98 was reported out of committee with 3-2 vote, and this is regarding the probationary term of service for secondary and elementary school teachers. It removes the option for local school boards to extend the 3-year probationary term of service for teachers by up to 2 additional years, and also the prohibition against school boards to reemploy any teacher whose performance evaluation during the probationary term of service is unsatisfactory.
Okay, you've heard the report. Is there a motion? Any member of the committee have questions? Senator Chafin?
Madam Chair. I've looked at this bill and reviewed it very carefully, and I think I understand what Senator Locke is trying to get at. But in my day job, I often represent school boards and have the pleasure of representing them. And I fear that what this bill will do is those teachers that are on the borderline, those teachers who have problems, when they reach that period, if we don't give the school boards an option to extend their probationary period, they're just going to can them. I mean, they're going to get rid of those teachers that are struggling. They're going to get rid of those teachers that are having some difficulty because they're not going to take that kind of chance. They're going to see teachers who have already been talked with and have had meetings with the principals, perhaps even the superintendent, and under current law, they're probably willing to continue to work with them and continue to keep them on life support if they see a promise or a hope. But I think this will cost a lot of jobs, the bill.
Senator Donovan?
Thank you, Madam Chairman. I will echo the comments of Senator Chafin. We heard testimony in the committee that the problem was that years ago when the state decided to make sure there could be up to 5 years of probation for teachers, that was stretched to pretty much 5 years for everybody. And that made it harder for teachers to reach that point where they were no longer on probation and felt like they had recourse if they were terminated. The intent of this bill was to give that kind of due process as it was expressed in the committee to teachers. The problem is, by eliminating any additional 2 years, we are running the risk of losing even more teachers that could succeed in our schools. And I think that it would be appropriate to consider an amendment that we would make probation 3 years, and on a case-to-case basis, it could be extended another 2, so we do not compromise the number of teachers that we have.
Thank you. Senator Locke.
Thank you, Madam Chair. In 2013, the General Assembly added this language to the Virginia Code that allowed for the probationary period for teachers to be the 5 years. Prior to this language being added, the mandate was for 3 years. The goal of the 2013 language was to ensure that teachers with up to 5 years of experience could be fired without any due process. That was the purpose of this language being added, and no other reason. A probationary period for teachers had for decades been 3 years. And to be clear, the code grants wide reason to terminate any teacher. It's not hard to fire a teacher if that is what a school district wants to do. It can be found in 22.1-307 of the code. So let's not kid ourselves on why these 2 additional years was added to the code. Thank you, Madam Chair.
Senator Hashmi.
I move that we pass the bill.
Second.
It's been moved and seconded that the bill be passed. Madam Clerk, open the roll. Close the
Yeas
roll.
9, nays 6.
The bill passes. Senator Hashmi.
SB 135, it is Children's Services Act regarding special education programs. It passed out of committee with a vote of 5 yay and 0 no.
Okay, it's going to be recommended to go to finance, but continue, please.
I'm sorry.
I said this bill is going to go to finance, but continue, please.
And it expands the eligibility of services under the Children's Services Act to children who transfer from an approved private school special education program to a public school special education program established and funded jointly by a local governing body and the school division located within Planning District 16 for the purpose of providing special education and related services.
Any questions of the? It has been moved and second that the bill be recommended for reporting and re-referred to Senate Finance. Madam Clerk, please open the roll. Close the roll, Madam Clerk.
Yeas 15, nays 0.
Thank you. Senator Hashmi, you have more bills.
SB 167 was recommended with reporting with amendment, and you should have the amendments in front of you. These were technical amendments, striking language in the bill.
Move the amendment, someone? It's been moved and properly seconded that the amendments be agreed to. All in favor, vote of aye. Aye.
Aye.
Opposed? Okay, Senator Hashmi?
And this bill regards the dismissal of teachers on the grounds of incompetency, removes the receipt of one or more unsatisfactory performance evaluations from the list of factors that incompetency may be construed to include for the purpose of establishing grounds for the dismissal of public school teachers.
Thank you. And if I'm correct, I have one speaking queue. Senator Chafin? Yes. Okay. Okay, there's no one in queue. All right, then we need a motion.
Madam Chair,
Senator Newman.
can staff just help us understand, it's a very short bill, what the amendment did? I don't have it in front of me, but.
Sure. So the amendment effectively removed all of line 23 and 25 subsection B from the bill. So it removes the definition of incompetency.
Senator Peterson?
I wasn't meaning to speak on the record, Madam Chair, but now I'll ask a question on the record. Isn't that the whole bill?
Well, Madam Chair,
Senator Newman.
great question. The question maybe to someone is, are you striking it or are you removing it from the bill? Because if you're striking it at all, we don't have a definition of incompetency. If you're removing it from the bill, that's a different deal. But if we don't have a definition of incompetency anymore, that is, so maybe staff can answer that and Mr. Peterson's question, I guess.
So we are removing all of subsection B from the bill, and that would.
Striking it out of
Yes.
code?
Yes.
Okay.
Yeah.
Senator Saslaw.
So there's no definition of incompetency?
Correct. It would be left to, I guess, the local school division to determine.
what?
It would
To
be
left-
left to the local school division to determine what incompetency means.
Wow. Really?
Senator Chafin.
Madam Chair, that means it's going to be left to the lawyers. That's what that means. It's going to be left to litigation, and it's going to be left to the lawyers to fight about in court. And it's wide open. It's a wide open bill. I probably wouldn't have said a thing if I didn't represent school board systems, but that's what we're talking about here, is that it's just going to be wide open, and it's going to be cannon fodder for the lawyers.
Madam Chair.
Senator Peterson, I have Senator Newman in queue
Oh, I'm
first.
sorry.
Senator Newman,
Well,
and then
just-
back to you.
Maybe it's for a lawyer question, but does this mean that what was de facto a problem, which is that you did not get the endorsement requirements, which is fundamental, and that you've had more than one unsatisfactory performance evaluation, is going to be litigated instead of being de facto a problem? It just seems to me that this is old standing law. I don't know why we do this, but Madam Chair, maybe I just vote no.
Senator Peterson, you're in queue next.
Thank you, Madam Chair. First of all, the current definition of incompetency, and I'm not sure why we would have to define a word that seems like it's self-evident, but it talks about including but not limited to consistent failure to meet endorsement requirements for the position. So since you use the words not limited to, it could be anything. So to me, it's incompetency. We don't define immorality. So I would be fine with the amendment.
There are no other speakers in queue. Senator Hashmi, would you like to repeat the
I
motion?
move that we report the bill.
Well, nobody's asked to come forward. I have nothing in queue. Nothing in queue. Senator Hashmi?
I move that we report the bill with amendment.
I'm sorry, I didn't hear you first time. I was listening to Senator Saslaw out of my really good ear. It's been moved and properly second that the bill be recommended for reporting as amended. All in favor? Madam Clerk, close the roll.
Yeas 9, nays 6.
Thank you. Back to you, Senator Hashmi.
SB 221, it was recommended with amendment, with a vote of 3-1 with one abstention. And this particular bill is focused on school boards and the local law enforcement agencies and MOUs with the frequency of reporting and public input. It shortens from every 5 years to every 2 years the frequency of the review period for MOUs between school boards and the local law enforcement agencies. And the bill also requires that local school boards to publish the current division memorandum of understanding on its website and also provide notice and opportunity for public input and discussion. And the amendment was, you should have it in front of you, was on line 23. It introduced after input and discussion. So
Did we get a motion on the amendment?
Small change.
It's been moved. Second, that the amendment be agreed to. All in favor, please let it be known by a voice vote, aye or nay. Aye. Senator Hashmi?
I move that we report the bill with amendment.
Been moved and properly second that the bill as amended be reported. All in favor of, please vote aye or nay. Thank you. Senator Hashmi.
SB
Yeas
299.
14, nays 0.
I'm sorry. SB 299, it was recommended to strike per the patron request. SB 324 was recommended, reported with substitute with a vote of 5 yay and 0 no. And you should have the substitute in front of you.
I think there might be just a question here. I think the bill that was recommended to be restricted is Senate Bill 299, Senator Stanley's bill. It's been recommended that the bill be stricken. It's been moved and properly second without any,
Sorry.
vote. Okay, now we're to Senate Bill 324, Senator Hashmi.
Yes, SB 324 was recommended reporting with substitute with a vote of 5-0. And it was regarding school bus drivers with critical shortages. I move that we recommend reporting with the substitute.
It's been moved and second that the substitute be adopted. All in favor, please let it be known by voice vote. Aye.
Aye.
Okay, Senator Hashmi,
I recommend that we report the bill with substitute.
second. And we want this bill to go to finance, so can I get a motion to that effect? Okay, it's been moved and properly second that that the substitute be reported and re-referred to finance. All in favor, please let it be known by electronic vote. Thank you.
Yeas
Senator-
15, nays 0.
Thank you, Madam Clerk. Senator Hashmi, Senate Bill 339.
Yes, SB 339 was recommended to strike per the patron request. I move that we strike the bill.
Strike. Madam Clerk. Thank you.
Yeas 15, nays 0.
Thank you. Senator Hashmi, Senate Bill 337.
SB 377 was recommended for reporting with a vote of 3-2. And this particular bill focuses on the teacher grievance procedures hearing and permits a school board to conduct a teacher grievance hearing before a 3-member fact-finding panel consisting of 1 member selected by the teacher, 1 member selected by the division superintendent, and an impartial hearing officer. It also removes the requirement that a teacher grievance hearing be set within 15 days of the request of such a hearing, and also extends from 5 days to 10 days the minimum period of advance written notice to the teacher of the time and place for such a hearing.
Thank you, Senator Hashmi. I see no speakers in queue. I need a motion.
I recommend reporting the bill.
It's been moved and second that the bill be reported. All in favor, please let it be known by electronic vote. Thank you. Senator Hashmi, you have one more bill, Senate Bill 8.
Yeas 9, nays 6.
Thank you, Madam Clerk. I'm rushing you, I'm sorry. Senator Hashmi.
SB 853 was recommended reporting with substitute. I move that we report with substitute.
Can I get a second? It's been moved and properly second that Senate Bill 853 be reported and be re-referred to finance. All in favor, please let it be known by I'm sorry, don't have a substitute. Yes. Madam Clerk, did we move the substitute first? It's a verbal vote.
Aye.
Aye? Okay. All right, now we can move to the motion and have it re-referred to finance. Madam Clerk, open the roll.
Madam Chair, can I?
Senator Newman.
Sorry, we didn't get an explanation of the bill. We got that the subcommittee liked it and there was a substitute, but could we just give a little bit more from the chair on?
Absolutely. Senator Highsmith, could you give us a?
Yes, this
Where's the
particular.
patron? Senator Borsco?
Good morning. So the difference between the substitute and the original bill was, requiring that we present criteria for schools to implement. The substitute actually creates an advisory committee for the purpose of examining these issues so that and we expect that the fiscal impact would be absorbed. They are already looking at the curriculum for social studies and history, so this would just be incorporated into that. I've been working with the administration on this for the inclusion and anti-discrimination issues.
Thank you, Senator Borsco. Senator Newman?
Madam Chair, just to make sure, in a number of these bills and the original bill, it said that whatever they come up with, school boards have got to adopt. I'm not seeing that in the substitute I just got.
Correct.
Is that now gone?
Correct. So this is creating an advisory council that the committee through the Department of Education to examine historical significance as they are looking at reconfiguring and looking at the SOL requirements. So there should, in the original bill, there would have probably been a fiscal impact. In this, we understand with a substitute should be absorbed within the DOE's scope of work that they're already planning to do.
Senator Newman?
I think I'm good.
Other questions? I see no one in queue. Senator Hashmi?
I move that we report the bill with substitute.
It's been moved and properly second that the substitute be reported. All in favor? Nays have the same right? Thank you, Madam Clerk.
Yeas 12, nays 2. Abstention 1.
Thank you. Senator Hashmi, that concludes your report.
Yes, it does. Thank you.
Thank you so very much. We'll move now to Senator Barker. You ready for health professions?
If I can get my coughing under control.
Well, you want me to come back to you? Okay, Senator Lewis. Senator Lewis, let's move to your report.
Yes, ma'am, Madam Chair. The report of the Health Subcommittee. Health Subcommittee considers Senate Bill 300, which was Senator Stanley's bill. It amended the state plan for medical assistance services to require the payment of medical assistance for remote patient monitoring services for rural and underserved populations with the home as an eligible telemedicine originating site. Senator Stanley presented the bill, and it was the recommendation of the subcommittee that the bill be reported with amendment 5-0. So we have to adopt the amendment, I guess, Madam Chair.
Okay, we need to adopt the amendment. Senator Donovan, I'm sorry, my cue just
Can we see
came up.
the amendments? Where are the amendments?
Behind your
Should be
report.
in your packet.
Madam,
Senator Donovan.
I'm sorry, Madam Chairman. I was concerned about Senator Barker, so I'm trying to catch up. Okay, thank you, Madam Chairman. I'm on the wrong bill.
Senator Donovan.
I'm okay. I was on the wrong bill.
Senator Newman has just moved the amendment. It's been moved in second that the amendment be agreed to. All in favor, please let it be known by the sign of, well, let's vote electronically.
No, just aye.
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 Okay.
And so it was the recommendation of the subcommittee, Madam Chair, that the bill be reported as amended.
And could you,
Re-referral? No?
and we refer to finance.
Re-refer to finance.
You got it?
Yes. Okay. It's been seconded that the bill be reported and re-referred to Senate Finance. Call the roll, Madam Clerk. Okay. Senator Lewis?
All right, Madam Chair.
I'm sorry, Madam Clerk.
Yeas 15, nays 0.
Thank you. Now, Senator Lewis.
Madam Chair, next we heard Senate Bill 301, which was again Senator Stanley's bill. It was directed at medically underserved areas and provided that emergency medical service vehicles may transport patients to 24-hour urgent care facilities, and also required that the Department of Health develop regulations for when emergency medical services agencies in medically underserved areas may transport patients to 24-hour urgent care facilities. The testimony from, or the presentation from Senator Stanley indicated that they were currently able to transport to these urgent care facilities, but the gravamen of his bill was to officially let these emergency medical service vehicles know that they could, but also to direct the promulgation of regulations as to what circumstances would be appropriate for those types of transports. So it was the recommendation of the subcommittee that the bill be reported 5-0.
Madam Chairman.
Senator Donovan is in queue.
Yes, I believe that this is the bill for which there was a conversation that was to ensue after the committee, and there is a proposed substitute that addresses some of the concerns in the committee. Do we have that? And has Senator Stanley seen that? Okay, I have discussed this with Senator Stanley. I'm a little hesitant to proceed without him, but this is this substitute is in keeping with the discussion we had. So I move with you know, the full foreknowledge that we can change it if we have to, I move the substitute.
It has been moved and seconded that the substitute be agreed to. Madam Clerk, we're going to have the substitute distributed before we take a vote. Thank you.
I know, thank you.
Could we have staff explain the amendment in the nature of substitute?
Madam Chair, what the substitute does is it strikes all of subsection A of the original bill and turns subsection B into a section 1 bill, asking the board to promulgate regulations as described by Senator Donovan.
Senator Donovan, you're still in queue.
Thank you, Madam Chairman. I have a couple of other pieces of language in front of me, but I do believe that this meets the intent of the amendments that Senator Stanley was friendly to, so I move the substitute.
It's been moved and second that the substitute be agreed to. We're going to make this an electronic vote. Madam Clerk, please open roll. Yes, this is the substitute. Well, this is the amendment in the nature substitute, yes. That we're, a voice vote. Let's go aye. Nay. Aye, nay, is that the same, right? Senator Cosgrove, is he in queue? Okay, thank you. Senator Lewis?
Yeah, and Madam Chair, Senator Dunlap's correct. I think the substitute speaks to the fact, as I indicated in my summary, that the emergency medical services or transporters are already permitted to stop at these urgent care facilities. And so this amendment recognizes that fact, but then does go on to hit the nut of what he was trying to do and get regulations promulgated as to when that would be appropriate and under what circumstances. And so I would move the bill as amended, or with the substitute.
It has been moved and properly second that the amendment in the nature substitute be agreed to. This is going to be an electronic vote. Thank you, Madam Clerk. Report the outcome.
Yeas 15, nays 0.
Thank you so much. Senator Lewis.
All right, Madam Chair. Next, Senate Bill 315, Senator Kiggins's bill. And Senator Kiggins requested that the bill be stricken. And so it was the recommendation of the subcommittee that the bill be stricken per the patron's request.
It's been moved to properly second. Please vote electronically. Madam Clerk, close the roll.
Yeas 15, nays 0.
Thank you so much. Senator Lewis.
And next, we considered, Madam Chair, Senator Kiggins' Senate Bill 317 regarding hospital inpatient psychiatric services, and it requires each hospital that provides inpatient psychiatric services to develop and implement a protocol for linking individuals who will be discharged from inpatient psychiatric care with in-home follow-up services. And obviously, the import of the bill is such that these folks continue to be helped and monitored after they're discharged from the psychiatric facility. There is a substitute, and it was the committee's recommendation that the bill be reported 4-0 with one abstention, that the bill be reported with the substitute.
Madam Chair,
Senator Kiggins.
I just wanted to add a line amendment to the substitute. In subcommittee, we discussed just tweaking it just a touch to make it even better. So on line 14, I'd like to add the words "as available" after nursing services. So it would be follow-up nursing services as available.
Can I move that?
Madam Chair, do we need to adopt the substitute first and then do the amendment? Is that the?
Yes.
Okay.
It's been moved and second that we first adopt the substitute. All in favor? Aye. Can you repeat the line amendment?
Yes, so the line amendment was to line 14, after follow-up nursing services, add the two words "as available."
Could I get a motion, please? If the amendment has been moved and second by Senator Howell, all in favor, please say aye. Aye. Yes. Senator Kiggins.
Sure. So just a little bit about the background of this bill. It provides for a continuity of care after inpatient psych stay for mental health patients. We've heard from mental health roundtables and families that once their patient is discharged, they're sent home kind of without any follow-up support. So having the eyes in the home in the form of an inpatient or a home health care provider, like nursing services. Originally, we had requested inpatient or in-home psych services, which is really a rarity. So just having that home health nurse that visits the home to do med management, making sure the patient is getting to their follow-up appointments, having the support there for the family. So I just feel like that's an important piece, and I see that on a daily basis, just having been a home health care provider and a mental health provider, that we leave these families with no resources after their patient is discharged. So just that set of eyes in the home from a nurse, doesn't have to be RN, LPN, whatever the home health service can provide, if available. The home health is not always as readily available in rural areas, but if it is there, then it would be absolutely just wonderful resource for those families to have that set of eyes in the home.
Thank you for that explanation. Senator Donovan.
Thank you so much, Madam Chairman. I'd just like to hear from the hospitals, if I can, on discharge planning. The intent here is to move us in the right direction. One of the challenges that we have, of course, in mental health is that really continuity is so important, and family support in the community. And these are the goals we're trying to achieve, so we don't have people relapsing back into crisis state. But at the same time, we want to make sure that this is something we can transition with the services that we have available and with the resources we have available. So I think that the idea was to make this permissive so that it could be done but was not mandated. And I just wanted to hear from the hospitals as to whether or not they thought this language sufficed.
Madam Chair, members of the committee, Brent Rawlings, Virginia Hospital and Healthcare Association. And this latest amendment is, I think, helpful. One of the concerns we expressed, as Senator Donovan conveyed, that you don't always have these services in the community. You don't always have insurance coverage for those services, and so we wanted to have some flexibility. I think the addition of the words "as available" is appropriate here. The only other note I would make would be whether or not, in all instances, not every psychiatric admission is the same, not every psychiatric patient is the same, and so do we know that in all instances a connection with in-home nursing is appropriate? So, I think this is flexible enough to allow. I mean, it's basically establishing a policy to create connections with a pathway. In-home nursing is one pathway. We just don't want to be exclusive, knowing that there are other community-based services out there. And I think this strikes an appropriate balance that we can work with.
Well, we thank you for that explanation. Senator Keegan, does that conclude?
And just as far as having other community services available, frequently just getting that home health nurse in the home, then she's kind of a good segue to working with primary care and requesting other services, social workers, just any other services that may be out there. So I think that this bill addresses the Hospital Association's concerns.
Thank you. It has been moved and second that the amendment in the nature of a substitute as amended be reported. Madam Clerk?
Yeas 15, nays 0.
Thank you, Senator Kickens.
Thank you.
Okay. Senator Lewis?
Madam Chair, next we considered Senate Bill 471, which was Senator Reeves. Senator Reeves requested that the bill be stricken, and it was the recommendation of the subcommittee that it be stricken per the patron's request. And so I would so move.
It's been moved properly second that the bill be stricken. All in favor, please electronically vote. Thank you.
Yeas 14, nays 0.
Senator Lewis?
Next, Madam Chair, we considered Senator McDougal's Senate Bill 521. This is something the committee has heard before. Senator McDougal has brought before. It was regarding the creation of the Office of Medicaid Fiscal Oversight and Accountability, which created an independent agency, the Office of Medicaid Accountability, and charged the agency with preparation of Medicaid forecast for the state, monthly oversight of Medicaid expenditures, review of the fiscal impact of policy changes, and other oversight and accountability responsibilities. And the bill created the position of Director of the Office of Medicaid Fiscal Oversight and Accountability. After some robust and familiar discussion, the subcommittee voted that the bill be passed by indefinitely on a vote of 3-1, and I would so move.
But didn't we have something like this as finance?
Yes. We did.
So,
Right. Senator Lewis, can you please repeat your motion?
Yes, ma'am. I move that the bill be passed by indefinitely.
Yeah, we dealt with it this year in finance. Yeah.
We have a little sidebar. Please excuse us for a moment. Can somebody please lower curtain?
Madam Chair, Madam Chair.
Yes, sir, Senator.
So I think we did have this bill last year, and it did not make it, but I think Senator Howell and others helped put together something, and it's not exactly what McDougal wants, but it's something, and they are giving some oversight. I kind of like this version, so I may vote for it, but I think we do have a process like this that Senator Howell helped establish.
Senator Howard, can you speak to that?
Well, I was just going to repeat the motion that we pass it by indefinitely because it is being handled elsewhere. Pass it by indefinitely as recommended by the committee.
Okay, you've heard the motion. It's been moved and properly seconded that the bill be PBI. All in favor, please let it be known by a vote of aye or nay. Senator, Madam Clerk.
Yeas 9, nays 6.
And Madam Chair, I skipped over Senator McPike's Senate Bill 386, which we also heard. Senator McPike's 386 authorizes the State Health Commissioner to disclose certain confidential data in the Emergency Medical Services Patient Care Information System, including information, research, or medical data that identifies patient by name or address with entities that seek to improve the delivery of pre-hospital and hospital emergency medical services, the quality of patient care, and access to medical services. And it was there was a substitute offered, and it was the recommendation of the subcommittee that the bill be reported with the substitute 4-0, and Senator McPike is here, Madam Chair.
Any discussion by any member of the committee? You've heard the motion? I'm sorry. The substitute has been, the motion is that the substitute be adopted, and it's been second. All in favor, please. Let's do electronic vote, please. Voice vote. Everybody say aye. Okay, now we're going to go with the motion again. Senator Lewis.
And so, with the recommendation of the subcommittee, Madam Chair, that the substitute be reported. And I would so move.
It's been moved and properly second. All in favor, please. So designate. Thank you. Now we're skipping down from Senate Bill 386 to Senate Bill 757. Senator?
Yes, sir. Yes, ma'am, Madam Chair. And this was Senator Favola's bill, Madam Chair, and it directed the Department of Health to determine the feasibility of establishing a medical excellence zone program and directs the Department of Health professions to pursue reciprocal agreements with states and that are contiguous to the Commonwealth for licensure for certain primary care practitioners under the Board of Medicine. And the bill further stated that reciprocal agreements with states that are contiguous with the Commonwealth for the licensure of doctors of medicine, of osteopathic medicine, and physician assistants and nurse practitioners should only require that a person hold a current unrestricted license. But there was a substitute offered, Madam Chair, and with the substitute, it was the recommendation of the committee that the bill be reported 5-0, so I would first move the substitute.
It's been a motion that the substitute be adopted. All in favor, please, voice vote.
Aye.
Thank you, Senator Lewis.
And then it was, again, Madam Chair, it was a motion that the bill be reported, recommend the bill be reported, and the vote was 5-0, and so I would so move that the substitute be reported.
It's been moved and properly second. Madam Clerk? Thank you, Senator Lewis. You have Senate Bill 913.
Senate Bill 903 was Senator
903.
Vogel's. She referred to this as Danny's Law, and we heard some compelling testimony from one of her constituents about a terrible incident that she had, that her former husband had, who was in mental health crisis as a result of some addiction issues. So this requires the Board of Health to amend regulations governing hospitals to require each hospital that provides emergency treatment to an individual experiencing a substance use-related emergency to complete a comprehensive assessment of that individual, complete a comprehensive behavioral health assessment to determine whether additional treatment may be appropriate, to initiate pharmacotherapy for treatment of drug or alcohol dependence where appropriate, and provide the patient with naloxone or other opioid antagonist for overdose reversal. The testimony we heard from Senator Vogel's constituent indicated that her husband had appeared in withdrawal or some kind of substance abuse crisis at a local emergency room and did not receive adequate treatment and subsequently, unfortunately, died after he left the emergency room. So there was a substitute offered, and I would move the substitute, Madam Chair.
It's been moved and properly seconded that the substitute be adopted. All in favor, please let it known by voice vote. Aye.
And with the substitute, Madam Chair, it was the committee's recommendation that the bill be reported.
Senator Donovan, I'm sorry.
I'm sorry, go ahead.
I just see you came up in queue.
This is another one of the bills that we realized in committee needed a few changes in order to make it practically implemented for Virginia. There's just a little obscurity in the language, and I think that the substitute or amendment that we got in committee was basically rolling in a bill of Senator Kiggins into the original bill of Senator Vogel, and I think that there are some amendments that have been agreed to by Senator Kiggins for that part of the substitute.
Senator Kiggins?
Madam Chair, the amendment that I added was just to include depression, mental health disorders, which is line 188 of the substitute. It's already been included in the, it
It's in the
was in
substitute?
the substitute that was just handed to me. It's already in
Okay,
there.
so in the
so-
substitute that we've already adopted?
Yes. So I'm good.
Senator Donovan?
Madam Chairman, I'd just like to review the substitute.
Senator Heisman, are you in queue?
No, I couldn't hear Senator Donovan's.
Madam Chairman,
Senator Donovan?
I just want to understand the substitute. Does the substitute strike the language from Senator Kiggins' bill?
That's correct.
Yes.
Thank you very much, Madam Chairman.
Okay.
Yes, I move the substitute.
It's been moved in second. I think Senator Lewis made that motion. Yes. Yes, that's been done. So now I need a motion on the bill?
Move to report.
It's been moved and properly second that the bill be, we're already there. Thank you.
Thank you.
Thank you.
And
Yeas 15, nays 0.
And finally, Madam Chair, we had Senate Bill 913, which was also Senator Vogel's bill. And that bill dealt with opioids and home hospice programs and specified that that hospice policies and procedures for disposal of drugs must include provisions for the safe disposal of opioids. And obviously, that's directed towards those situations where the hospice patient expires and there are opioids and medications left in the home. And so it was the recommendation of the subcommittee that the bill be reported 5-0, and I would so move.
It's been moved and properly second that the bill be reported as, Senator Lewis, I'm sorry, I think that that's straining to hear up here. So can
Yes,
we
ma'am.
increase the volume?
I can't, Madam Chair.
Okay, I think the clerk can. So Senator Lewis, if you could please repeat that motion.
Sure. It was the recommendation of the subcommittee, Madam Chair, that the Senator Vogel's 913 be reported, and I so move.
It's been moved and properly second that Senate Bill 913 be reported. All in favor? Thank you, Madam Clerk.
Yeas 15, nays 0.
And that completes our report, Madam Chair.
Thank you so very much. And I'm sorry for those of you who waited, but I think once we get through the subcommittee reports, that may cover a lot of what are the bills that you all might have been waiting for. Senator Barker, are you okay to do your?
I'm ready. I'll give it a try, so.
Thank you.
Thank you very much. This is the Health Professions Subcommittee. First one is Senate Bill 120, which was my bill. It deals with providing support and civil immunity for supportive type programs to help physicians and others to be able to deal with some of the stresses of their jobs, et cetera. It was recommended for reporting by the 6-0 vote, and I'll make a motion to recommend to report the bill. Oh, no, there's not a sub on
No,
this
it's
one.
not on this one.
No.
Okay. Senator Barker, has made the motion. It's been moved and properly second that vote. Madam Clerk,
Yeas 15, nays 0.
thank you. Senator Barker.
Next one is Senate Bill 122, dealing with teledentistry. We do have a substitute for that. There was one issue at least that was still being discussed at subcommittee level, and the parties have agreed on the language for that. And so I would move that we adopt the substitute, and that when we do that, we roll in Senate Bill 210 from Senator Locke and Senate Bill 884 from Senator DeStiff.
So we're gonna roll 210 and
884.
884.
Right.
Into Senate
Yeah,
Bill
122.
122.
Right.
As amended. It's been moved and properly second. Madam Clerk,
We need to adopt the substitute.
we need to adopt the substitute, so, all in favor, please.
Yeah.
I think we've got those, so what we need now is a voice vote, I think. Yes, all in favor, please say aye.
Aye.
Thank you. Senator Barker,
With that, I'd move that we report the substitute.
it's been moved and properly second that the substitute be reported. All in favor, please let it be known electronically. Madam Clerk,
Yeas 15, nays 0.
thank you. Senator Barker.
All right, skipping on down to Senate Bill 365, Senator Donovan's bill. This deals with provider credentialing and what it does is it sets a deadline, 14 days for approval of credentialing through like a health plan. Once a hospital has provided credentials to a provider. There was significant discussion on that. There are issues that are out there. There was some question as to whether this was a bit of a far step to try to deal with that issue, and it did not move forward. It was a 2-2 vote, but I'll be happy to.
Madam Chairman.
Senator Donovan.
There is a substitute on this bill that's created consensus between the stakeholders, changing it to a Section 1 bill that would allow a convening of the entities that are involved in this credentialing process, which would allow us to develop. This is a real problem for Virginia. It is a problem for access for providers being readily available because they are obstructed by the time that it takes to credential. And it's a compounded effect because it's not just credentialing from hospital to hospital, but it is between health plans and hospitals. And one of the biggest hurdles in that is verifying the primary source materials to verify that a provider is who they say they are. And so what we're trying to accomplish with this work group is that we will be able to develop a single primary source entity for Virginia to make credentialing easier for all of these entities going forward. And Madam Chairman, with that, I hope you'll move the substitute.
It's been moved and properly second that the substitute be adopted. All in favor, please let it be known by voice vote. All in favor? Aye. Nays have the same right. Senator Lewis. I'm sorry, Senator Barker.
All right. Well, I'll defer to Senator Donovan if she wants to make a motion on the bill. So.
Thank you, Madam Chairman. I move that we report the Section 1 bill as amended.
It's been moved and second that the bill be reported as amended. All in favor? Thank you. Madam Clerk?
Yeas 15, nays 0.
Thank you. Senator Barker.
Next bill is Senate Bill 431 from Senator Surville. It would prohibit a healthcare provider from entering into an agreement to provide mental health services with a condition that the limiting access to such minors' healthcare records. There was a good bit of discussion on this, and in the end, we decided this was went farther than we thought was appropriate here, and so we did vote 7-0 to recommend passing by indefinitely. There is a substitute, and that was provided for that.
You've heard the motion. All in favor, please let it be known by electronic vote.
Okay.
Thank you. Madam Clerk?
Yeas 15, nays 0.
Senator Barker.
And then the last bill is Senate Bill 538 from Senator Newman. This is the annual bill we have relating to drugs that are on the Schedule 1 list there that are basically the most dangerous drugs. There's some updates to that at the federal level, so we every year adopt that here in Virginia on our list there. So with that, we recommended reporting on a vote of 6-0, and I would move that we report the bill.
It's been moved and second that the bill be reported. All in favor, please let it know on the electronic vote. Thank you. Madam Clerk.
Yeas 15, nays 0.
Thank you.
And Madam Chair, I made it through.
Let's give that a applause. Thank you so much.
Yeah.
Okay, we're gonna go, before we go to the the members' bills that were not heard in subcommittee, I'm gonna go to the queue and start with those members who signed up. Excuse me. Okay, I have in queue Senator Bell. Is Senator Bell here to present his bill? Okay, you might want to give Senator Bell a call because he's first in line, and then Senator McPike, and then Senator Morse. Say again? Senator McClellan has been here the whole time, and I'm wondering why her. These are bills not heard in the substance. Okay, well, this is what I have. Why don't I go here first? Senator McClellan, you've been waiting for a while, so why don't we just hear from you while my board has been refreshed. Senator McClellan.
Thank you, Madam Chair. I have Senate Bill 733.
Hold on a second, Senator.
Before Senator McClellan starts, she has Senate Bill 733, and I have Senate Bill 68. I would like to have my bill rolled into Senator McClellan.
Senator
Bill 68.
Senator Locke, please turn on your mic and.
It's not.
Okay. Go ahead.
Senate Bill 68. Her bill is more comprehensive and includes what my bill includes. So I would like to have my bill rolled into hers.
Okay, Senator McClellan, we're gonna have Senator Locke, Senate Bill 68 roll into your 733. And so without objection, okay,
Voice vote, electronic vote.
okay. I gotta catch up with my notes. Okay, electronic vote to have Senate Bill 68 roll into Senate Bill 733. Please let it be known by electronic vote.
I had already told her.
Thank you. Senator McClellan. Thank you, Senator Locke.
All right, thank you, Madam Chair. Senate Bill 733 is a bill that would remove provisions of the code that are medically unnecessary and serve as barriers to access to abortion care in Virginia. It does four primary things. It repeals the requirement that an individual receive a transabdominal ultrasound at least 24 hours before the performance of an abortion. It repeals the requirement for only a physician to provide, it repeals the requirement that only a physician provide a first trimester abortion and would allow other healthcare providers, including physician assistants, nurse practitioners, physician assistants and nurse practitioners acting within their scope of practice and in consultation with the doctor. It repeals the requirement for medical professionals to provide biased and medically inaccurate information prior to an abortion. And it repeals the requirement that facilities performing 5 or more first trimester per month be regulated as hospitals, otherwise known as the TRAP laws. This bill coincides with the American College of Obstetrics and Gynecologists' recommendations that recognition that decisions regarding abortion should be made by patients in consultation with their health care providers. The bill also corrects inequities in the law that have disproportionately impacted poor women and women of color who face more barriers when trying to access reproductive health care than their white or wealthy counterparts. I would like to take each provision one at a time. The first section is the section that would repeal the 24-hour waiting period and the transabdominal ultrasound requirement. This requirement is medically unnecessary and frankly useless for over 90% of the abortions which occur in the first 10 weeks of pregnancy. A transabdominal ultrasound really cannot see the fetus or show what gestational age is. Usually in the first 10 weeks of pregnancy, you need a transvaginal ultrasound. As a matter of fact, when I was pregnant for the first time and had to have my first ultrasound, and when the doctor was trying to determine gestational age, I had to come back later because in that first ultrasound, they could not determine gestational age because they could barely see the fetus at that point, and that was with a transvaginal ultrasound. The requirement for medical professionals to provide medically inaccurate information. The bill does not say that we will never have informed consent. And as a matter of fact, informed consent is a part of the medical profession's scope of practice. We do not mandate that in the code for any other procedure, but informed consent is provided. For example, when I had my colonoscopy, I was given very detailed information about the procedure and potential complications before the surgery or the colonoscopy was given. Similarly, when my husband had spinal fusion surgery, he was given pretty detailed information about that surgery and what the risks were. But this code mandates information that is not medically accurate. A 2013 analysis of Virginia's information packet found that 22% of the statements were medically inaccurate, and specifically when pertaining to the first trimester, 41% of the information was medically inaccurate. Again, we should not single out one procedure to mandate specific information to be provided when we don't do that for other procedures. The TRAP laws is repealed. This is the requirement that facilities performing 5 or more first trimester abortions be classified as a hospital. Significant portions of this law, including the building code requirements, have been found unconstitutional and as a result are not being enforced. Again, an abortion procedure is as safe as other procedures that are not required to be done in a hospital, such as colonoscopies, oral surgeries, micrographic surgeries used to treat skin cancer, EGDs, which I cannot pronounce what that stands for, so I won't even try, liposuction, cryosurgery, incision and drainage, and EDNCs, again, another procedure I cannot pronounce, so I will not try. And then expanding the list of professionals who can perform these procedures. This bill would allow physician assistants and nurse practitioners acting within their scope of care or scope of practice and with the supervision of a physician to perform first trimester abortions. The American College of Obstetricians and Gynecologists, the American Public Health Association, the World Health Organization, and a report by the National Academies of Science, Engineering, and Medicine all support allowing advanced practice clinicians to perform medication and aspiration abortions. In a recent court decision, Judge Hudson wrote that the plaintiffs provided extensive supporting evidence at trial that advanced practice clinicians, as well as other similarly trained and licensed healthcare providers, are capable of providing medication and aspiration abortions, which are routine first trimester procedures. 9 states allow these professionals to perform first trimester abortions, and again, these professionals are allowed currently to perform gynecological procedures that are very similar to aspiration abortion in technique and risk, such as inserting IUDs, performing endometrial biopsies, and managing miscarriages using the exact same process used in an aspiration abortion. They are also allowed to provide medications similar to those that are used for medicinal abortion. You were given written testimony from a number of folks, the American College of Obstetricians and Gynecologists, the Virginia Section and National, Physicians for Reproductive Health, the Center for Reproductive Rights, the National Women's Law Center, the National Partnership for Women and Families, the National Institute for Reproductive Health, the National Abortion Federation, the Reproductive Health Access Project, Power to Decide, and Women of Reform in Judaism. And I'm sure there are a number of people here who would also like to speak.
Senator McClellan, Senator Sasslaw has a motion. He wants to roll his bill into yours. Go ahead, Senator Sasslaw.
what I would, I've got a bill that's Senate Bill 21, which is pretty much the same as Senator McClellan's, but what I'd like to do is conform my bill to hers and roll my bill into her bill, which is 733. So you'd be rolling 21 into 733. And she would be listed as the chief sponsor, and I would be chief co-sponsor.
But she and Senator Locke, so there will be
Madam Chair,
Senator Newman.
I have a question. That is a consequential motion. I think I understand it, but as I understand it, your 21 will now go into 733, but the language of 21 will not follow it.
No,
Instead,
it'll track hers identically.
it'll track hers identically. One, I just want to thank Senator Sasslaw for doing that. That's a very good move. Thank you, sir.
So that means that Senator Locke's bill and Senator Saslaw's bill will both be rolled into Senator McClellan's 733. Yes. But I need to have that amendment approved. So that's going to be a voice vote to roll Senator Saslaw's Senate Bill 21 in.
I think it's recorded.
That's going to be recorded. That's right. I'm sorry. It's a lot. Madam Clerk, open the roll. We're going to have a recorded vote. Thank you.
Yeas 15, nays 0.
Okay, Senator McClellan.
I also do have three technical line amendments that I think have been provided to staff.
Staff, please.
Yes, Madam Chair, there are three technical amendments. First, on line 84, after 18.2-74, strike the physician, insert the licensed healthcare provider authorized to provide the abortion. And then on line 86, after the word "the," strike physician and insert licensed healthcare provider. On line 88, after "may the," strike physician and insert licensed healthcare provider.
Patty. Everyone clear with those?
I move the amendment.
It's been moved and properly second that the amendments be agreed to. All in favor, please let it be known electronically. Okay, we're gonna do a voice vote. It's not open. Voice vote? All in favor, aye? Aye. Nays have the same right. Thank you. Senator, Madam Clerk, that's why I wanted to have a recorded vote, because I knew this was gonna happen. Okay. Could we please have a recorded vote?
The line.
Well, it's not open. Do you want to just have her record your no votes? So you have 5? 6? Okay, do a roll call. Madam Clerk, please. That's why I thought we needed a roll call. Thank you. Thank you. Okay, Senator McClellan?
Yes, I mean, I've explained the bill. I think the last thing I will say, and this is particularly on the portion dealing with the ultrasound, which Senator Locke's bill covered, and I'll tell a very quick story. I had a friend who suffered fetal demise in the 7th month of her pregnancy. She got devastating news on a regular checkup and had to schedule a D&C to complete that miscarriage. Had this law been in effect when that happened to her, she would have had to have an additional ultrasound. She would have had to be asked, would you like to see the image? And would you like to listen for a heartbeat that her physician and she would know was not there? That would have been cruel. If you think that is hyperbole, that's exactly what happened to another friend of mine after this law was passed. The ironic thing is she did a story on the ultrasound bill, interviewed me, and I told her the story of my first friend. And then later, when the same thing happened to her, she couldn't believe it and said, you know what, you were exactly right. And so I think that portion of the bill is particularly important and I bring on behalf of both of those women.
Madam Chair.
Thank you. Senator Newman. And Senator,
Just a question, or really, question. I mean, clearly, if your bill was about transvaginal and it went to the standard of care, right, we probably could get reasonable support here, because no one wants to go beyond the standard of care, I don't think. I think the original bill may have, but that's not what's critical in the bill. I mean, I think the informed consent, safety standards, and that type of thing are the items that are of great consequence here, because I think we could probably come to a way on transvaginal that we could agree. You could reasonably say we should have done it last year, year before, but I think that if we went to the standard of care, it's still done. After your bill, it's still going to be done under the standard of care when it's needed, but it's just not going to be mandated under the code, right?
That's right, and I am not aware of any other medical procedure where the informed consent and the specificity of that informed consent is in the code and in the criminal code at that. But that informed consent, yes, is still given when it's part of the standard of care, just like in my colonoscopy.
Madam Chair, so it's true also that on transvaginal, when the standard of care indicates it needs to be done, which is often, it will still be done. Is that correct?
If the physician under the standard of care believes that that should be done, then yes.
Okay, thank you.
with all of the explanation and the amendments to the substitute, I think there's a motion that has been made.
I think there are a number of people who would like to testify.
I've just been reminded of the 5-minute rule, but we changed ours to 3.
Okay.
Yes, sir. So I'll have those who will be speaking in favor first. You have 3 minutes, so if you want to just be respectful to the others who want to hear, if you can abbreviate your remarks, those who will be remaining will be asked to stand in support. Please go.
Good morning, Madam Chair. Gina Berger, Deputy Secretary of Health and Human Resources. The administration does strongly support this bill as it puts the practice of medicine back into the hands of healthcare providers rather than the General Assembly. And it's a recognition that we trust women to make their own healthcare decisions in consultation with those healthcare providers. Thank you.
Thank you.
Hello, good morning. My name is Dr. Shanti Ramesh, and I'm an OBGYN and abortion care provider. Currently, I serve as the medical director at the Virginia League for Planned Parenthood and care for patients throughout the Commonwealth of Virginia. Today, I'm speaking as an expert in abortion care and as an advocate for my patients for whom I care every day. No two of my patients are the same. Many are mothers, many are working 2 or 3 jobs, trying to finish school, and some are in the military. All of my patients are making personal medical decisions about their futures. Currently, due to medically unnecessary restrictions, including the 24-hour waiting period, mandatory ultrasound, physician-only laws, my patients must pay for and arrange for 2 trips to see me, childcare, travel, and days off work, which can equate to multiple days or weeks. Many cannot obtain abortion care in their communities because of these restrictions and travel across the Commonwealth to see me. The laws that we're talking about today were passed under the guise of health and safety, but we know that these restrictions do nothing to improve care. This is because abortion care is exceedingly safe. In fact, reports from the Centers for Disease Control and Prevention report a 99% safety record. In those rare cases where complications do occur, they are managed identically to a miscarriage. We all support patients' health and safety, but abortion restrictions are not about health and safety. They are aimed at reducing access, often for my most vulnerable patients. I have patients every day for whom these unnecessary burdens mean deciding between gas in their car to get to their abortion and paying their bills this month. It means risking an abusive partner finding out they're pregnant as they travel across the state to have their abortion, and patients who are pregnant as a result of sexual violence having a deeply traumatic ultrasound. These are my patients and fellow Virginians, and they deserve better.
Can you just stop the clock for a moment, Madam Clerk? There's a long line of people and the 39 seconds left. I need each of you to please just come forward and state your name and your group within the 39 seconds that are left. I know that's going to be tough, but let's
Yeah,
try.
my remarks are very brief. My name is Dr. Wendy Klein. I'm a physician long committed to the health and safety of the women in Virginia, and I'm here to ask that you support Senate Bill 733. I'm here to ask that you restore the primacy and integrity of the patient-provider relationship, that you trust women to know their own needs, to live by their own spiritual dictates. No one is being deprived of information. No one is being deprived of ultrasounds, which are the standard of care. This bill simply rolls back the intrusive measures intended to dictate the nature and content of patients' interactions with their healthcare providers. It's time to roll back the arbitrary barriers, such as mandatory 24-hour delays. The demeaning subtext behind these is that women seeking abortions are ignorant, or poorly informed, or have not thought through what they are doing. Shame on those who insult the intelligence and integrity of women in this way. One last thing. It's time to roll back the TRAP laws that were purported to be about safety, but in fact have done nothing to improve safety data. First trimester abortions were safe before TRAP, and the only thing that happened with TRAP is abortion clinics closed down, making it harder to get.
Okay, stop the clock, please. Okay, we've extended beyond a minute, so we're going to have to give the other side 4 minutes. Right now, I want everybody in this line to give me your name and state your organization, please. That's it. No, ma'am. Name and organization,
Wait a minute.
please.
I'm a former member of the House of Delegates, and I'm here because I've been before this committee many, many times, and I was here to speak out against restrictions on abortion, and I'm happy to see the changes in the makeup of this committee, and this will be a happy day. Thank you.
Please give me your name.
Catherine Waddell.
I knew that, but I give everybody else didn't. Thank you.
Madam Chairwoman, Nicole Pugar-Lauder, on behalf of the American Congress of Obstetricians and Gynecologists, we support the bill.
Thank you so much.
Thank you, Madam Chair and members of the committee. My name is Casey Ensign, and I'm here on behalf of the Medical Society of Virginia, and we support the bill.
Thank you.
Good morning, Madam Chair. My name is Tarina Keene. I am the Executive Director of NARAL Pro-Choice Virginia, and on behalf of our 25,000 members in Virginia, we wholeheartedly support this bill.
Thank you.
I'm Rebecca Gottwald from Fairfax. I'm represented by Chet Peterson. I've had an abortion, and I am absolutely in favor of this bill.
Thank you.
Nicole Tortorello on behalf of the ACLU of Virginia, and we support this bill. Thank you.
Hi, Pam Pouchot from Yorktown. I'm a woman, and I am a Virginian, and I support this bill. And I'm with NARAL.
Thank you, Pam.
Good morning. I am Stephanie Nash. I'm here on behalf of Whole Women's Health Alliance, and we support this bill.
Thank you.
Good morning. Casey Chavez from Fairfax. I support this bill.
Thank you.
Good morning. Taylor Bernstein, Falls Church. Senator Saslaw is my senator, and I support this bill.
Thank you.
Morning. My name is Sarah. I'm from Yorktown, and I support this bill.
Thank you.
Good morning. My name is Taylor A. Council from Zuni, Virginia, and I support this bill.
Thank you.
Anna Owens, and I support the bill.
Thank you.
Abby Henderson of Sterling, I support this bill.
Thank you, ma'am.
Michelle Woods, I'm one of the 72% of Virginians who trust a woman to make her own medical decisions, and I support this bill.
Thank you.
Good morning. I'm Jamie Lockhart. I'm the Executive Director of Planned Parenthood Advocates of Virginia, and we enthusiastically support this bill. Thank you.
Thank you.
My name is Adeline Bruger, and I'm from Mechanicsville, Virginia, and I support this bill.
Thank you.
Hello, my name is Michelle Wooten McFarland. I'm from the Newport News area, and I support this bill, and I urge all of you to do the same. Thank you.
Thank you so much. Now, those who are here in opposition to the bill, could you please form your line? You have 4 minutes, because I'm going to give you the same amount of time as the first speakers had. So govern yourself accordingly within the 4 minutes. because after each person has stood to state their name and their organization, I'm going to turn off the mic and the camera. Thank you.
Understood. Yes, ma'am. Good morning. Hello. My name is Paige Coulter. I'm the Director of Nursing for 5 medical nonprofit clinics in Southampton Roads. I'm a registered nurse and I do ultrasounds every day. I have scanned hundreds of women who not only ask for ultrasounds to see how far along they are, but want to see the ultrasound and are grateful to see the ultrasound. No one can know what is going on inside their body without having an ultrasound, and pregnancy cannot be confirmed without ultrasound. I fear that women who do not have ultrasounds would be putting themselves at risk for a procedure that is not medically necessary. Up to 25% of pregnancies end in miscarriage. So a woman who does not know that she has a viable pregnancy may put herself through an abortion without even having to do so and be risking physical and emotional complications from that. So this part of the bill is what I think is most important, and an ultrasound is definitely vital before making any kind of decision. Imaging prior to a procedure is necessary. Senator McClellan talked about her husband having back surgery. I'm sure that doctor did an x-ray of his back before proceeding with that procedure. Thank you.
Thank you.
Good morning. I had a whole speech outlined that I was going to do, but I'm just throwing it out the window, and I'm going to speak to you as an individual, as a mother. My story is a little bit different. I was diagnosed with hyperemesis gravidarum, and it left me unable to drink water or even eat for 2 weeks. I had went to an abortion clinic to get an abortion, and as I was there, they told me that my doctor hadn't sent in the ultrasound. And while I was in the hospital during my stay for a 7-day stay in the hospital, the only reason they released me was because my mother actually helped me dump out the food and dump out the water so the nurses and the doctors would think that I was actually able to eat and drink so that I could get to this abortion. When I got there, they told me that I had to have this sonogram, that it had to be 24 hours. Like I said, the hospital would not send it over. They couldn't get it in. So I went back to the room, and they told me that they were going to do another ultrasound. When they did this ultrasound, my baby had a heartbeat when he did not have a heartbeat. I was showing every single sign of a miscarriage, and all I wanted to do was end my suffering. Had I not gotten that ultrasound that day, my son would not have been born, and ultimately, I would have probably ended up committing suicide because that was not a choice that I could have made or lived with had I not had that ultrasound done. So I'm asking you to stand against this bill and make it so that they have to have the ultrasound. It saves the lives of children, and it also potentially saves the lives of mothers. Thank you.
Madam Clerk, could you stop the clock for a moment? I'd like to have the doctor come forward because I did have a request for him to speak. Could you please come forward? I got this request yesterday, so he needed to have been in the queue.
Dr. William Fitzhugh, I own 3 abortion centers in the state of Virginia, Richmond, Roanoke, and Newport News. I have worked with nurse practitioners and physicians and assistants for a long time. I support the bill. I do not support the use of nurse practitioners and family physicians assistants. There is a program in the OB community where they are developing family planning experts with a 1-year training of doing abortions at the facilities. This new program will provide all the abortion providers in the state of Virginia a surgical abortion, a safe procedure, but is it a surgical procedure? If a complication arises, there is no time for consult with other providers. I support nurse practitioners and physician assistants to provide medical abortions. The surgical abortions, I am opposed to providing an undertrained person to care for my wife and daughters.
Thank you. Madam Clerk, can you please turn the clock back on? You have 51 seconds left. So you might want to abbreviate your remarks so that at least the others will have an opportunity to state their name and the organization that they're representing today.
Thank you, Madam Chair. I'm Chandra Jarrett, and I'm from Portsmouth, Virginia. I had an abortion when ultrasound was not mandated, and because it was not mandated, the doctor did not show me the ultrasound. When I had the procedure, I bled out and had to have a blood transfusion as a result of it and suffered trauma for 25 years. So I oppose this bill.
Leanna Balmer from a nonprofit medical clinic in Northern Virginia. On behalf of 24,000 Virginians that support the Virginia Pregnancy Center Association, we oppose this bill and the restriction of information it results in for women.
Thank you. We're in overtime, but please, I just want the rest of you just to state your name and your organization.
Okay, Olivia Turner, Virginia Society of Human Life. We oppose this bill. Remember that Judge Henry Hudson in September of this past year ruled that it was constitutional and not burdensome to have a 24-hour waiting period, the ultrasound requirement, and he rejected the idea that non-physicians should be doing abortions, medical or surgical. Very important. Thank you, and please oppose this bill.
Yeah.
Madam Chair, Jackie Gonzalez with the Family Foundation. And according to a poll that was released yesterday, 69% of the public supports the laws that we are about to completely obliterate from the code.
Thank you.
And I'm among those people. Thank you.
Yes.
Julia Sabanos with the Virginia Catholic Conference. Please oppose this bill.
Thank you.
Good morning. My name is Valerie Myers. I live in the Richmond area, and I strongly oppose this bill. I would also like to say to all of those who have lost a family member, a little boy or a little girl, to abortion, I am sincerely very sorry for your loss. Anybody in this room, anybody hearing my voice, I am sincerely sorry for your loss. The loss is real and it's important, and I pray for hope and healing for anyone in that situation. Thank you very much.
Thank you, Madam Chairman, and members here. My name is Toby DeBosch, and I am the CEO of the Keim Centers in Southampton Roads, and I would say I strongly oppose this bill, and it breaks my heart today to see this happening. Thank you.
Good morning, Madam Chair. My name is Christine Robinson from Virginia Beach, Virginia. I'm the Vice President of Operations for 3 nonprofit medical clinics. We see women every single day asking for abortion, and I oppose this bill. Thank you.
Good morning. Kimberly Logston, Chesapeake, Virginia, Keim Centers. I strongly oppose this bill.
Thank you. Senator McClellan.
Yes, I just want to make 2 points in rebuttal. First of all, this bill will not prohibit or end the practice of providing an ultrasound if the physician feels within their scope of practice it's medically necessary. With my first pregnancy, I had at least 3 ultrasounds, including first to determine, to verify in fact that I was pregnant and to find the gestational age. With my second pregnancy, I had 5. So they will be provided when in the scope of practice the physician feels they are necessary. On the physician assistants and nurse practitioners, we already allow under Virginia Code 54.1, 2400.01, physician assistants and nurse practitioners to perform other surgeries. This law makes no distinction, the current law makes no distinction between types of abortions. And a medicinal abortion is very similar to other medications that these professionals are authorized to give. And so they are trained, they are licensed, they are regulated by this state, and they are able to perform these procedures just as safely within their scope of practice under a physician's supervision as other items we already allow them to do.
Thank you, Senator McClellan. There's a motion that the substitute be reported as further amended, and it has a second to it. And all in favor? Senator Chafin, yes. I just didn't see your name in queue. Any name in queue.
If you know the answer, can you tell us what other states that we will be joining the ranks of? You indicated there were 9. I assume California would be one of them. But Can you tell me those others?
I specifically, do you mean for, that allow?
For the non-physician,
yes.
yes, non-physician.
California, Colorado, Connecticut, the District of Columbia, Hawaii, Illinois, Maine, Massachusetts, Montana, New Hampshire, New Jersey, New Mexico, Oregon, Rhode Island, Vermont, Washington, and West Virginia.
Thank you, Madam Chair.
Senator Newman?
Madam Chair, it's not a question, just speaking to the bill.
Senator Newman.
Madam Chair, I do believe on the transvaginal that the standard of care is going to mean that this is still going to continue on because it's what's best for the patient in most cases. So I'm struggling a bit less with that because I believe the standard of care is actually going to be consistent with what the current law is. Madam Chair, I think that this legislature has put in place, however, a number of other items over the years that ensure that a woman's safety and also understanding that there is no other procedure like this. There is no other procedure that we deal with that ends the life of another person. This is unlike anything else because it's different than everything else. Madam Chairman, this committee, we agree and we disagree and we kind of punch in one way or the other, but this is a monumental decision that we're about to make. The 24-hour waiting period is, in my opinion, critical, not just because it medically is helpful, but because of the monumental decision to end another life should be considered greatly before we do it. And that's why we put it in. Madam Chair, the informed consent, if we were all here to talk about what's medically correct in different trimesters and let's make sure that the information in informed consent is correct, we could have a bill to do that. But this bill removes the informed consent. And Madam Chair, I think that has been helpful to women who ultimately can make a different decision to protect life. Madam Chair, I think probably the biggest item that we're concerned about, it not the Northeast United States and California notwithstanding, is a decision to change the practice of physicians performing abortions. Madam Chair, there's many questions that I have, and I imagine that a few of the lawyers on this committee may be the only one to answer them on what this means to med-mal. What happens when a nurse practitioner is working within their scope of practice as defined by others, but they allow a woman to bleed out? What happens in those cases? What happens to the med-mal? What have been the reaction and the impact in other states that have allowed nurse practitioners to go down this path? And then, Madam Chairman, the issue of minimum safety standards. We have reviewed those over and over again, and we've done it because we want to make sure that the surgery that takes place in a place where it can be ultimately safe for the woman that's going to have the abortion. Madam Chairman, we cannot impact Roe versus Wade. Roe versus Wade is a federal decision, but we can make sure that if abortions are being done, that they are properly considered with the 24-hour waiting period, that we allow for an informed consent, make sure that the individual that is performing the abortion is a physician, and that we have minimum safety standards. So, Madam Chair, for those reasons are the reasons why I very much oppose the bill.
You've heard the motion?
Madam Chair,
I don't have,
it's in the queue.
okay, it's just upgraded. In the queue, it has now Senator Suderline and Senator Donovan.
Thank you, Madam Chair. Speaking briefly to the bill, I was astonished as someone who's carried legislation to expand scope of practice in the past for practices that had been taught at those schools for more than 3 decades and had a majority of the states in the country already doing it, and having the Medical Society of Virginia fighting tooth and nail to hear that the Medical Society of Virginia now supports expansion scope of practice. So I'm not happy about it on this bill, but I look forward to hearing them supporting expansion of scope of practice as it appears in other states and when we're in the Health Professions Subcommittee, because that's not something I've heard for the previous 5 years. Also, I reject the premise that any procedure is safe in which every time it happens, a human life ends. And it's for that reason that I oppose the bill.
Senator Donovan?
Thank you, Madam Chairman. First, a question for the patron. Can you tell me what surgeries nurse practitioners and PAs are allowed to do in Virginia within their scope?
I do not have a list of that memorized. I do know they are authorized under 51.4, 2400-01.1 as being able to provide, oh, here, I'm going to phone a friend.
Hi, I'm Dr. Ramesh. I supervise nurse practitioners who are performing gynecologic procedures as outpatients, including colposcopy, LEEP, IUD insertion, endometrial biopsy, incision and drainage, vulvar biopsy, other tissue biopsies, similar things.
Thank you, Madam Chairman.
Senator Donovan?
I would ask, since we've made a comparative analysis, can nurse practitioners or PAs do colonoscopies?
I do not know that off the top of my head. They can, however, provide labor and delivery services to patients in their home.
That they cannot do colonoscopies, Madam Chairman. And so I'd like to speak to the bill a little bit.
Senator Donovan?
Thank you. An abortion is not a colonoscopy. All of the procedures that were listed previously by the doctor that supervises nurse practitioners, and I supervise nurse midwives and work with a nurse practitioner as well. All of those procedures are in-office procedures, and one of the hallmarks of medical care is that you must be capable of managing any complication of a procedure that you do. And one of many complications of abortion, potentially, is perforation of the uterus. And that is managed by laparoscopy. And a nurse practitioner nor a PA can do laparoscopy in any definition of their scope. So this is a serious consideration. We have heard a physician who works with nurse practitioners and PAs in abortion clinics and supervises them, and he has recommended against the need for them to be included in this scope, and in fact has stated that if a available workforce is necessary, that available workforce is now being trained by medical residencies. So my first point is that I am very concerned about the expansion of scope, and I think it's inappropriate in this bill. The second thing is I spoke with Senator Locke earlier. I do not think that the ultrasound language should be in code. And I have long stated that standard of care should not be mandated in code. It should be managed by clinicians. So I have no objection to removing that, and you're correct. An abdominal ultrasound does not see first trimester pregnancies. However, a 24-hour waiting period, which, by the way, was found to be non-obstructive by Judge Hudson that you referenced earlier in one of the points that you were asserting, as not obstructing access to abortion, is an incredibly prudent intervention. And I will speak to personal experience I've had with women who, even in the first trimester of pregnancy, have found themselves under incredible social duress to have an abortion. And they have acted quickly because they're in a really terrible situation and maybe without any family support. And I have been the one that they have come back to, that have connected them with support services as they regret and have profound remorse over that. I cannot tell you how painful it is to support a woman who has had that loss and is seeking to find resolution. And there is no harm in giving a woman 24 hours to consider the decision she's being made, because again, this is unlike any other procedure.
with those points, Madam Chair, I hope that this committee will not pass this bill because I do not think it is in the best interest with all of its assertions for women's health care in Virginia. Thank you.
Madam Chair,
Senator Locke, you're next in queue, and then Senator Saslaw.
Madam Chair, I would just like to say that what this is about is trusting women and their physicians and whomever else they choose to discuss these decisions with about making their own reproductive choices and making their own choices about their pregnancies and making their own health decisions without the interference of politicians. That's what this is about. And I would like to hope that those of us sitting up here, particularly those who are in opposition to this legislation, would express the same outrage and opposition if we were having a similar discussion about the death penalty.
Senator Saslaw, you're next in queue.
It's, Madam Chairman, members of the committee, it's been my observation over the years that any time we propose something that deals with the medical profession, if the Medical Society of Virginia thinks we're going in the wrong direction, they're in here in a flash. And they're not, one bit shy about letting us know what their views are. They've known about this bill for some time. And I've not been lobbied either by them or by any other surgeons or anybody with an MD in front of their name that we were, by allowing nurse practitioners that we were creating, a problem. That said, the other observation I have is that I've been hearing these bills for 30 years and up here. And virtually every single one of them that's been put on the books, not all, but virtually every single one of them has been put on by men, okay? The other thing, listening to some of this, I kind of got the opinion that if men could get pregnant, there'd be more abortion clinics than Starbucks. And, this, we need to end. This doesn't affect us. I think by and large, women know what's best for their own body, and we ought not to be telling them that. So I would renew the motion that the bill be reported, the substitute bill be reported as amended.
Senator Saslaw, I still have Senator Donovan in queue unless.
She spoke.
Did she already speak? Yeah, but right now, can you please update my queue screen?
I am waiting to speak, Madam.
She does one.
Okay, Senator Saslaw, are you still in queue? Can you?
I'm done.
Okay, then please close out your button. I can only see this screen. I have now only Senator Cosgrove in screen. I have now Senator Cosgrove and Senator Donovan in screen.
Go ahead.
Oh, okay. Thank you, Madam Chairman. Question for the patron. Senator Locke, said this should be a decision between a woman and her physician, okay? Under your bill, would a woman have to see a physician at all in this process?
It depends. First, I want to make sure everyone is aware, as pointed out on lines 77 and 78, that a physician's assistant and a nurse practitioner would have to be acting within their scope of practice. And so it depends on the specific procedure used. If the procedure used is within their scope of practice, then a physician assistant or a nurse would perform the procedure. More likely than not, there would be a physician who is supervising, or the woman probably would have already seen a physician to determine whether or not she was in fact pregnant.
Madam Chairman, I guess the answer to my question is not necessarily. So under the terms of your bill, using a PA or other healthcare professional, the whole idea of this decision between a woman and her doctor really isn't that decision that's going to be made. And that's why I have the problem with the PAs and the nursing staff instead of having a physician do this. Thank you.
Madam Chair, I would just respond that anytime a woman is pregnant, she's going to go to a doctor. She's going to talk to that doctor to determine what that means, what her options are. She's probably going to talk to a lot of people. She's going to weigh the decision very heavily and not make that decision lightly, and talk to anyone that needs to be a part of that decision, whether she's mandated to do so by law or not.
Okay. Thank you, Senator Cosgrove. My queue has been updated, and I have now Senator Donovan, who's going to speak her second time on this bill, and Senator Locke, who will speak a second time on this bill. Senator Donovan.
Thank you, Madam Chairman. I would just say, first of all, based on the language changes you've made, there is no requirement for a woman to see a physician when she's pregnant. And if a woman is going to a clinic, they will often go there and not see a physician. So just point of clarification, it does indeed do what Senator Cosgrove asserted. But secondly, I feel a strong need to speak up after some comments made earlier. I am a woman. I am a woman who is a physician, and I take care of women every day. I support them in their decisions because I practice patient-centered medical care, and there are no obstructions based on this bill to access for abortion in Virginia. And passing this legislation is more of a political move than it is actually creating access for women. Thank you, Madam Chairman.
You're welcome. Senator Locke, you get the last word on this bill.
Just, Madam Chair, I just wanted to clarify. I said the decision would be made between a woman, her physician, and whomever else she wishes to consult, just to clarify.
Thank you, Senator Locke. Now, we have a motion to recommend reporting Senate Bill 733 as amended. Well, it's the substitute as amended, and that is going to require an electronic vote. Madam Clerk, please open the roll. Madam Clerk, report the outcome.
Yeas, nay. Yeas, 9, nays, 6.
Senator McClellan, your bill has been recommended for reporting.
Thank you, Madam Chair.
We've considered a lot of bills this morning, and we have lots of bills still coming before education and health, but that's all that we're going to hear this morning. So without objection, the committee will rise. Yes, sir.